There is little statistical data on the national prevalence of mental ill health in the country. But according to a 2006 report of the World Health Organization, 7.4% of Ugandans suffer from depression, anxiety, and alcohol use disorder. The numbers could be higher though, because patients who live in rural areas rarely seek medical help. Dr. Hasfalukwata, the Acting Assistant Commissioner for Mental Health and Control of Substance Abuse in the Ministry of Health, says many people dealing with mental health are not even aware of what they are experiencing. So there is a high possibility of tipping the scales in this COVID-19 wave.
There are people who are worrisome, there are people who are fearful, there are people who are anxious, there are people who are like, they are not mentally ill, but they are not normal as well. So these ones, with now the changes in whatever is happening currently, they are most likely to tip to the other side.
This anxiety, the worry, and the possibility of depression actually also extends to the family members, but also members of the public, especially because they worry about the possibilities that could come. What if the patient doesn't make it?
Dr. Rachel Arinaitwe, a psychiatrist, advises that because of their near-death situation, those who have healed from COVID-19, especially those who are hospitalized, need to see a mental health specialist as part of their recovery process.
Some people may not get the support because many people are being nursed at home, but ideally everyone should be able to get mental health and psychosocial support. The patients themselves who have recovered, the health workers taking care of these patients, but also people like the caretakers.
Eventually, after the lockdown, we will have new cases of people with mental health problems. Those with pre-existing mental health conditions will have worsened. And so, I mean, we are getting into a situation that is completely very tricky.
The 2018 Mental Health Act integrates mental health services with primary health care. Uganda has 13 regional referral mental health treatment units, but since March 2020, these units were gazetted for the treatment of COVID-19 patients. This has been a big blow to the services offered to mental health patients, many of whom need chronic care or drug refills.
Unfortunately, this is now outpatients. Going to happen like you do not have to leave the patient at the hospital. You just come with the patient, they are treated, and you go home. If it is very severe, the regional referral hospitals have been able to put in place some corner where they're providing mental health services for people with mental illness.
However, Dr. Lukwata says this innovation is not ideal because it exposes mental health patients to COVID-19.
Our units usually have that boundary wall around them. So these ones are they are part of the hospital, so you can find people loitering within the hospital.
Uganda has a population of about 45 million. However, it has only 40 psychiatrists, 80% of whom are based in Kampala. This means that much of the psychiatric care has to be done by ourselves.
If you can access a government health facility, you'd be able to get the starting point of your mental health care. And there's always room for referral where someone feels like they cannot manage anymore.
It's important to stay away from too much news about COVID because the information coming in now is on new cases, people dying, and so it's usually not very good for mental health.
With people losing loved ones every day and the financial distress that comes with a lockdown, severe stress is definitely on the rise. Experts advise that we should rediscover soothing music, physical exercises, prayer, and talking to people as coping mechanisms. Gillian Nantume, NTV, Weekend Edition.